Three common fungal infections which you must know in this summer before you spread it to yourself and to others. Well, few days back, I had a small patch on my cheek and I was wondering what it was. It was itchy and it was red and it was lightly spreading. And then I understood, because I see so many fungal infection cases, I would have picked up probably from a table which I sit onto, or probably just, by touching the patient sometimes without the gloves. Yes, fungus can get communicated and transmitted even from surface to surface and from touch to touch of the skin. So this you should be careful about, and this is easiest way of how you can get a fungus from one person to the other. Why in summers? Because in summers we are sweaty, the skin is moist, and that's what the fungus loves. Whenever we have fungal infection on our skin, we tend to get mist because sometimes it is not even symptomatic. You don't even come to know. But in this video, I'm going to give you all the three important fungal infections. Till the end, you will be able to diagnose them and take care of them with the help of a doctor easily. The first is called as tinea. We also called it as ringworm. You must have seen this in the form of scaly red patch, and it increases in size. You may see it on the face, you may get it on the hands, you may get it mostly on the groins, under the chest, even on the feet and on the legs. They're so itchy that the patient is uncomfortable, and that's why they will definitely come to a doctor. But you know what? Before that, they sometimes go to the chemist who gives them a steroid cream. So the classical history, what I see is, with application of that steroid cream, the fungus goes away. But the moment you stop the cream, the fungus comes back bigger and more redder and more with a highly infectious stage, like an angry looking patch. And this is what is fungus. That's why fungus is a medical condition. You must come to a doctor to get it treated. Second, we call it as tinea versicolor. In Marathi, we call it as sibla. It is like a absolutely asymptomatic brownish or whitish patch, which you must have seen in sports people or teenagers who don't bathe well. So, on the chest we have seen that, on the back you can get it, even on the face, in the form of very fine scaly off-white kind of color, but they are non-itchy, and that is why it gets absolutely ignored for months together till we see the entire back filled up with a fungal infection. So this is also another type, a common type. Go to a doctor. It needs minimum 2 to 3 months of treatment, and that is how it gets removed from the skin surface. The third, again another important one, is candidiasis. Now candidiasis is different from the first one. It's more happening on the moist areas which retain a lot of sweat, like under the breast, between the toe fingers, and it stays there for a longer time. It keeps eating the skin from inside, so you may feel like there's a little depression also, and is very resistant to treatment. People feel it is just like a sweat or something like that, but no, candidiasis also needs 2 months or sometimes 3 months of a treatment. So all these three infections look different. In summers, understand superficial fungal infections are common. Go to a doctor and get them treated well. If you want to know what are the three habits which lead to a fungal infection, stay tuned for my next video.